session, I will be discussing shock. So what is shock? What is the definition of the shock? How we will define shock? So shock is not a disease of one particular organ in human body. So shock is a clinical syndrome that results from poor tissue perfusion of multiple organs in the body. Imagine a condition in which all body organs are receiving less blood. Less blood means less oxygen. Less oxygen means less oxygenated blood or less pure blood to all the organs. So all the organs do not receive enough oxygen, do not receive enough nutrients to allow the cell function. So ultimately in all organs of human body, first cellular death take place. If multiple cells of an organ is dead, the organ failure will result, and ultimately multiple organs in the human body are failed, multiple organ failure takes place, and ultimately death take place. So can I say it is a clinical syndrome? It is not a single organ disease in which only one organ is involved. Shock is a clinical syndrome in which multiple organs of the human body undergo failure because of inadequate tissue perfusion of multiple organs, inadequate oxygen supply to multiple organs of human body. That is shock. So shock is a clinical syndrome in which there is poor perfusion of multiple organs of human body. So first cellular death take place, then tissue death take place, then organ failure take place, then multiple organ failure take place, and ultimately death take place. So it is a clinical syndrome which takes place step by step. That is shock. Now coming on the classification of the shock. How many types of shock are there? Shock is basically, the important ones are of three types: hypovolemic shock, cardiogenic shock, and septic shock. In others, we will be discussing some minor type of shock, but the major type of shock are three. So we will be discussing them one by one. Now let me tell you the causes of each of them. The first type, the most important type of shock, is hypovolemic shock. We know that in human there is 5 liters of plasma, 5 liters of the blood. If the blood loss is there due to any reason, it can be acute hemorrhagic blood loss due to accident, road traffic accident, it is a sudden blood loss, it can be chronic blood loss in the form of peptic ulcer, in the form of the hemorrhoids, in the form of internal bleeding. So acute or chronic hemorrhage is there, dehydration due to vomiting and diarrhea, burns, extensive use of diuretics, and acute pancreatitis. Due to any reason, if blood loss or plasma loss is there, so less than 5 liters of plasma is present in human body, that is known as hypovolemic shock. As the name indicates, the volume of plasma is less. That is hypovolemic shock. So the cause of the shock is less amount of plasma present in human body, supplying less oxygen to all organs. So that is hypovolemic shock. The second type of shock is cardiogenic shock, in which the heart is doing inadequate systole or diastole. If inadequate systole, it is known as defective emptying, and if it is inadequate diastole, it is known as defective filling. Either emptying, that is systole, is defective, or filling, that is diastole, is defective, or obstruction to the outflow. These can be the reason the heart is not pumping properly and blood is not going ahead and it is not supplying to all the organs. That's why all the organs have inadequate blood supply, inadequate oxygen. That is hypoxia. That is cardiogenic shock. The third important shock is septic shock. In septic shock, there is infection. Infection is by bacteria. We know bacteria are of two types, gram-positive and gram-negative. So both of them can cause septic shock. It can be gram-negative septicemia. It can be gram-positive septicemia. If gram-negative bacteria causing septic shock, it is known as endotoxic shock, because we know gram-negative bacteria secrete endotoxin from them. And if the septicemia or the shock is caused by gram-positive bacteria, it is known as exotoxic shock. Initially, it was thought that endotoxic shock is more common than exotoxic shock, but nowadays we know that the most common cause of septic shock is the gram-positive bacteria, not gram-negative bacteria. So we will be discussing, that is the causes of the three type of shock. So we will be discussing the three type of shock in detail one by one. Apart from these three important type of shock, there are some other shock also. We will not see the details of them, but we should be able to enumerate them. Though one is traumatic shock, in which severe injuries, surgery with the marked blood loss, or obstetrical trauma can be there. Neurogenic shock, so high cervical spinal cord injury, accidents causing high spinal anesthesia, or severe head injury can result in neurogenic shock. Or hypoadrenal shock, that is administration of high dose of steroids, secondary adrenal insufficiency. These can be the causes. So you should know the names of other type of shock along with their few causes, but don't go in the details of these because they are not really important for the exam. From exam point of view, 3 shocks are very, very important: hypovolemic shock, cardiogenic shock, and septic shock. So we will be discussing them one by one in detail. So their presentation, their pathogenesis, their symptoms, their etiology, everything of all of them. So let's discuss the first type of shock, that is hypovolemic shock. So I'm discussing the first shock, hypovolemic shock. In hypovolemic shock, it is the most common type of shock out of all the 3 important causes of shock. It occurs due to decreased blood volume. As the name indicates, hypo means decrease, volumic means volume, less volume of blood. As I have told you, humans have 5 liters of blood. Now, due to blood loss or dehydration, if less than 5 liters of blood is present in human body, it can lead to hypovolemic shock. So let's start hypovolemic shock. We can divide the hypovolemic shock into 4 categories depending on the amount of the blood loss. Now imagine if the blood loss is less than 1 liter, it is known as compensated. If it is 1 to 1.5 liter, it is known as mild hypovolemic shock. If it is 1.5 to 2 liter of blood is lost out of the 5 liter, so it is known as moderate hypovolemic shock. And if more than 2 liter of blood is lost, plasma is lost, it is known as severe hypovolemic shock. So it is of 4 types. You can say compensated, mild, moderate, severe, depending on the amount of blood which is lost. So is it less than 1 liter, 1 to 1.5 liter, 1.5 to 2 liter, or more than 2 liter? So compensated, mild, moderate, severe type of hypovolemic shock. That is the classification. So we have seen the definition, we have seen the classification. Now coming on the pathogenesis of hypovolemic shock. What is the etiopathogenesis, or what is the cause of hypovolemic shock? So it can occur due to inadequate circulatory blood volume due to various causes. It can be blood loss, it can be diarrhea, it can be vomiting, it can be burns, it can be dehydration, it can be anything due to any cause. Now see, this is the master flow chart explaining the pathogenesis of all 3 types of shock. In this flowchart only, I will be discussing the pathogenesis of all 3 types of shock, that is hypovolemic shock, cardiogenic shock, and septic shock. So in this diagram, you can see if hypovolemic shock is there, the causes can be hemorrhage, trauma, surgery, burns, dehydration, that is diarrhea, vomiting, anything. So because of anything, if hypovolemic shock is there is decreased effective circulating blood volume. Normal blood volume is 5 liter, but due to these all causes, less than 5 liter of blood is present in human body. So there is less venous return. Because of the less venous return, there is less cardiac output. Because there is less cardiac output, less blood flow to all organs. Less blood flow to all organs leads to less supply of oxygen to all organs. All the organs they are not receiving adequate oxygen. So they undergo anoxia or hypoxia or anoxia. That can lead to inflammatory mediators, and that ultimately leads to shock. So you can understand this is the pathogenesis of hypovolemic shock in front of you in the form of the flow chart. This is how you have to write in your exams. Right. Now the same I will explain in this diagram. Imagine the body is having less than 5 liter of blood, either due to trauma, dehydration, diarrhea, vomiting, due to anything. Less than 5 liter of blood is present. If less than 5 liter of blood is present, less venous return is there. So venous return is less. Venous return is the amount of blood coming in right auricle from SVC, IVC. Since less volume is present, less venous return. Less venous return, less amount of blood will go in the right ventricle, less amount of blood will go in the lungs for purification, and less amount of purified blood will come in the left side of the heart in the left auricle via pulmonary vein. So less blood is coming in the left auricle. Less blood is coming in the left ventricle. So less blood will go in the aorta. When the left ventricle do systole, less blood. This is known as less cardiac output. So less venous return leads to less cardiac output. This is how less venous return on the right side leads to less cardiac output from the left side. Right side, the amount of blood coming is venous return. From the left side, the amount of blood leaving the amount of pure blood from the left side leaving the heart, that is known as cardiac output. Since venous return is less, so cardiac output is less. Since cardiac output is less, so less blood is going in the aorta and less blood is received by all organs. So all organs of human body receive less blood. Less blood means less oxygen. Less oxygen means hypoxia or anoxia. That is causing inflammation of all organs, and that can lead to multiple organ failure, that can lead to shock. So the pathogenesis and diagram is in front of you. It is crystal clear. Now coming on the symptoms of hypovolemic shock. Hypovolemic shock, there are basically 4 symptoms. So to compensate, the heart rate increases. That is known as tachycardia. There is less blood pressure. So here you can see less amount of blood is going in the aorta. So less amount of blood going in the aorta, so less blood pressure is there. To compensate, the heart rate is increased. So increased heart rate, that is tachycardia to compensate. The blood pressure is less. Now less blood is going in the kidney, in all organs. So kidney is one of the organ. So less blood is going in the kidney, that will cause oliguria in the kidney. So in kidney there is oliguria, and less blood will go in the brain. In the brain it will lead to altered mental status, that is agitation or confusion or lethargy. So less blood is going to the brain also. So these are the symptoms: increased heart rate, that is tachycardia; decreased blood pressure, that is hypotension; less blood to the kidney, renal insufficiency leading to oliguria or anuria; and decreased blood to the brain leading to altered mental status. It can be coma, it can be death also. So these are the symptoms. Now coming on the stages of hypovolemic shock. Hypovolemic shock is having 3 stages. What are the 3 stages of hypovolemic shock? It can be mild hypovolemia, that is stage 1. It can be moderate hypovolemia, that is stage 2. It can be severe hypovolemia or stage 3. So depending on the volume of blood which is lost. If less than 20% of the blood is from the human body is lost, less than 20 liter means out of the 5 liter, if I consider 100% as 5 liter, less than 20% is less than 1 liter. If less than 1 liter of blood is lost, it is known as mild. If 20 to 40% of the blood is lost, 1 to 2 liter of the blood is lost, it is known as moderate. If more than 40 liter, that is more than 2 liter of blood is lost, it is known as severe. If it is mild, what are the symptoms? Patient only have tachycardia, no other symptom. If it is moderate, along with tachycardia, hypotension is also there. And if it is severe, along with tachycardia, along with hypotension, disorientation and oliguria will also be there. So in mild hypovolemic shock, only tachycardia is the symptom. In moderate one, along with tachycardia, hypotension will also occur. And in severe one, along with tachycardia, along with hypotension, organ involvement, that is oliguria, anuria, and disorientation can also occur. Altered mental status will occur. So that is the stages of the hypovolemic shock, their definition along with their symptoms. Now, we are done with hypovolemic shock. We know the pathogenesis, we know the stages, we know the symptoms. So coming on the second type of shock, that is cardiogenic shock. In cardiogenic shock, it is caused by inadequate pumping of the heart. So the heart is unable to pump properly. So it occurs when 40% of the left ventricle is destroyed. Now you can see this is the diagram of a heart. See, this is left ventricle. If the wall of the left ventricle is destroyed by more than 40%, 40% of the wall of the left ventricle, this is the wall of the left ventricle. More than 40% of the wall of the left ventricle is destroyed, the systole will not be so vigorous. Systole will be very weak because most of the wall is destroyed. So weak systole is there, so less blood will go in the aorta, less cardiac output. Less cardiac output, less blood will go in all organs will receive less blood, that can lead to shock, and such a shock is cardiogenic shock. Now this shock is normovolumic. Cardiogenic shock is normovolumic, that is volume is normal. That is patient have 5 liters of blood. Patient do not have less than 5 liters of blood in contrast to hypovolemic shock. In hypovolemic shock, patient is having less than 5 liters of blood, that is hypovolemia. Here, patient have normovolemia, still patient have shock. Because the reason of shock is here not less blood volume. The reason for the shock here is inadequate pumping of the heart. So that is normovolumic shock. So such a shock is known as normovolumic shock. You can see the pathogenesis is acute cardiac failure in case of normovolemia. So here you can see that is cardiogenic shock. If there is cardiogenic shock, either there is a problem in systole or there is a problem in diastole or there is a problem in outflow. That is filling defect, emptying defect, or it can be outflow obstruction. Due to any reason, the cardiac output is decreased. Now, most common you can see it is systole defect. So heart is unable to do the pumping if the systole is not adequate. If wall of the left ventricle is destroyed, more than 40% of the wall is destroyed, it is doing inadequate pumping, inadequate emptying. So less blood will come in aorta, so cardiac output will decrease. So you can see less cardiac output, less blood will be received by all organ, less oxygen received by all organ. All organ have anoxia and ultimately hypoxia and anoxia, and ultimately it will lead to inflammatory mediators, it will lead to cardiogenic shock. So this is the pathogenesis of the cardiogenic shock you can appreciate in this diagram. So that is cardiogenic shock. What are the symptoms here? The symptoms of cardiogenic shock, first the tissue hypoxia will be there. All the organs are receiving less blood. So tissue hypoxia. After that, you can see in this diagram, this is the left ventricle. Here less systole is there. Systole is not proper because the wall of the left ventricle is destroyed. We have understood that the wall of the left ventricle is destroyed. That's why it is not vigorous systole. It is very weak systole. So the first problem is that blood is not going ahead, that is forward failure. So all the organs are receiving less blood, that is known as tissue hypoxia, that can cause symptoms. Symptom in the kidney, that is renal failure, symptom in the brain, that is altered mental status, and symptom of all other organs. All other organs have hypoxia or anoxia. This is forward failure, but blood is not going ahead, so where the blood is going? Blood is not going ahead, so blood will flow backward. Since the left ventricle is not contracting, blood is not coming in aorta. Blood is moving backward. From left auricle, it is moving to left ventricle. From left ventricle, it is moving to pulmonary vein, and from pulmonary vein, it will accumulate in the lungs. It will lead to pulmonary edema. So pulmonary edema is also a feature of cardiogenic shock. In cardiogenic shock, two problems occurs. One is forward failure, one is backward failure. In forward failure, the blood is not coming ahead into the aorta because left ventricle is not doing the systole. So blood is not going ahead. So causing various organ dysfunction. And blood is going backward. Since the left ventricle is not contracting, so blood is going backward. And from backward, it is getting accumulated in the lungs, causing pulmonary edema. So there are two types of symptoms. Number one, tissue hypoxia, that is due to forward failure. And number two, pulmonary edema, that is backward failure. Due to pulmonary edema, patient have dyspnea. So we are done with hypovolemic shock, the pathogenesis, the symptoms. We are done with cardiogenic shock, the pathogenesis, the symptoms. Now coming on the third, the most important and difficult to understand type of shock, that is septic shock. So what is septic shock? What is septic shock? Septic shock is, again, we can divide into two types caused by the type of bacteria. Septic shock is a shock caused by bacteria. So bacteria are of two types, gram-positive bacteria, gram-negative bacteria. Gram-positive septicemia and gram-negative septicemia. If it is caused by gram-negative bacteria, it is known as endotoxic shock. If it is caused by gram-positive bacteria, it is known as exotoxic shock. Initially, it was considered that endotoxic is more common than exotoxic, but nowadays we know that most common cause of septic shock is gram-positive bacteria. It is not gram-negative bacteria. So exotoxic shock is more common than endotoxic shock nowadays. So this is a very important point that you must understand. Now coming on the pathogenesis of septic shock, it is very difficult. So if it is gram-negative bacteria, in gram-negative bacteria, the endotoxic will come in. In gram-negative bacteria, the lipopolysaccharide or endotoxin will come in role. In gram-positive bacteria, it is lipoteichoic acid will come in the role. So first, I will read this flow chart to make you understand. After that, I will draw a diagram to help you in understanding the same concept. So first, I will read this flow chart. If there is any bacteria present in the blood of human, whether it is gram-positive or gram-negative, it is undergoing lysis. So the patient is having septicemia, that is bacteria is present in the blood. So due to the lysis of the bacteria, if it is gram-negative bacteria, endotoxin will come in the blood. If it is gram-positive bacteria, lipoteichoic acid will come in the blood. So either endotoxin, that is lipopolysaccharide, or lipoteichoic acid, anything is coming in the blood. That will form a bond with lipopolysaccharide or lipoteichoic acid binding protein present in the blood. And that will go to the macrophage and bind with CD4/14 receptor present on the macrophage. The couple, that is LPS, LBP. LPS is lipopolysaccharide, LBP is lipopolysaccharide binding protein. This couple will go to CD14 receptor on the surface of the macrophage and stimulate macrophage. Macrophage will secrete certain cytokines. The name of the cytokines is TNF alpha and IL-1, and they will cause various effects. They will cause vasodilation. They will cause, due to the vasodilation, there is hyperdynamic circulation. They will cause increased vascular permeability, so the fluid will leak out. It will lead to edema, and that will lead to decreased perfusion and leading to organ dysfunction. So here I would like to draw a diagram showing you the same explanation of the septic shock. See, this is the blood vessel of a patient lined by the endothelial lining. This patient is having septicemia, either of gram-positive bacteria or gram-negative bacteria. If it is gram-positive bacteria, this one is gram-negative bacteria. The bacteria undergo lysis. When the bacteria undergo lysis, from gram-positive bacteria, lipoteichoic acid leaks out. And from gram-negative bacteria, lipopolysaccharide, also known as endotoxin, leak out. So this lipoteichoic acid and lipopolysaccharide, they will form a bond with a protein. The name of the protein is lipopolysaccharide binding protein. So the couple, lipopolysaccharide binding protein along with lipopolysaccharide or teichoic acid, it will go to the macrophage. This is a macrophage. On the surface of the macrophage, CD14 is present. CD14 receptor is present on the surface of the macrophage. So this is ultimately, these are going here along with the protein binding protein and stimulating the macrophage by binding on CD14 receptor of the macrophage. The macrophage will get stimulated and macrophage secretes certain cytokines, especially TNF alpha and interleukin 1. These cytokines are causing two things. Number one, they are causing vasodilatation. So this blood vessel undergo dilatation. So that is known as hyperdynamic circulation, in contrast to other two shock, that is hypovolemic and cardiogenic shock, in which hypovolemic circulation is there. Here hypervolemic or hyperdynamic circulation is there because of vasodilatation. Number two, these TNF alpha and IL-1, that is cytokines, they will increase vascular permeability. That is the endothelial cells will contract, so fluid will leak out. Since the fluid will leak out, here it will cause edema. So less fluid will be present, less plasma is present here in the blood. So less supply to the less supply of oxygen to the organ, that will cause hypoxia or anoxia of the organ. So the pathogenesis of septic shock is difficult, but this is the flow chart. You can understand how it is causing, and this is the diagram. So same thing is shown here also. You can appreciate. It can be gram-negative bacteria having lipopolysaccharide leakage. It can be gram-positive bacteria having lipoteichoic acid. It can be some super antigen causing direct activation of T cell. So anything is present, ultimately it will cause activation of macrophage. Macrophage, on the surface of the macrophage, CD14 receptor is present. They will bind with CD14 receptor and cause activation of macrophage. From the macrophage, cytokines will be leaked, that is TNF alpha and IL-1. This TNF alpha and IL-1, they cause secondary mediators release, they cause vasodilatation and capillary leak, and that can lead to septic shock. This is the pathogenesis. So here in this diagram also you can see this is septic shock, either due to gram-positive bacteria or gram-negative bacteria. Ultimately, whether gram-positive or gram-negative bacteria, the end result is increased capillary permeability. So fluid leaks out. So less fluid, less cardiac output, less blood flow to the organ, less oxygen supply to the organ, ultimately leading to anoxia and inflammatory mediators, and ultimately leading to shock. So you can appreciate in this diagram the three types of shock along with their pathogenesis: hypovolemic, cardiogenic and septic. The three type of shocks, the pathogenesis in one diagram I have shown you. So due to the septic shock, due to gram-positive septicemia or gram-negative septicemia, ultimately due to increased capillary permeability, most of the fluid is leaked out causing edema. So less cardiac output, less supply to the organs, less blood supply, less oxygen supply. So all organs undergo hypoxia or anoxia and causing shock. So this is how it is happening in septic shock. Now, septic shock is different from the other two shock. It is having a specialty. It is having two stages: early hyperdynamic stage and late hypodynamic stage. In early hyperdynamic stage, patient have vasodilatation. So because of the vasodilatation, patient is having more blood in the organs. But although tachycardia and decrease initially normal cardiac output and then decrease cardiac output. So initially, because of vasodilatation, the extremities are warm. Later on, due to vasoconstriction, the patient have oliguria and cold extremities. So these are the stages. Now, apart from these three type of shock, neurogenic shock is there, which is caused due to the interruption of sympathetic vasomotor supply, and an anaphylactic shock can be there, which is due to type 1 hypersensitivity. I'm not going in the details of these two type of shock because they are not important. Now coming in on the common pathogenesis of all three type of shock, whether it is hypovolemic shock or cardiogenic shock or septic shock, three features are common. What are the three common features here? You can appreciate the common features. So three features are common in all type of shock, the three main type of shock. There is reduced circulatory blood volume, there is less supply of oxygen to the tissue, and there is inflammatory mediators or cytokines. So you can see in all of them three features are common: decreased circulatory volume, decreased blood supply, decreased oxygen supply, and inflammatory mediators. That is common for all three type of shock. So that is the pathogenesis of the shock. Now, if all the organs of the body receive inadequate perfusion, so cell hypoxia is there. So because of the cell hypoxia, anaerobic glycolysis will take place inside the cell, because cell want to synthesize ATP from some other source. So anaerobic glycolysis will lead to metabolic acidosis because of lactic acid production. Because of metabolic acidosis, cell membrane dysfunction and failure of sodium-potassium pump will take place. Ultimately, it will lead to capillary endothelial damage and destruction and dysfunction and cell death. So this is how cell death take place. Now coming on the stages of the shock. All the shock, whether hypovolemic or cardiogenic or septic, we have discussed individually the pathogenesis of all three type of shock. In all of them, three stages are there. The first stage is compensated. The second stage is non-progressive decompensated stage. And third is irreversible decompensated stage. So compensated 1, it is the early stage where the cardiac output and BP is maintained because of compensation. What is the compensation? You can see the compensation in this flow chart. So whenever in hypovolemic or cardiogenic or septic shock, there is hypovolemia to any organ. So kidney is the main organ which is very sensitive for hypovolemia. If renal perfusion is less, there are certain cells inside the kidney which is known as juxtaglomerular apparatus, JJ apparatus. It will stimulate it. The JJ apparatus stimulation will lead to renin secretion from the JJ apparatus. Renin is an enzyme which converts angiotensinogen to angiotensin 1. Angiotensin 1 get converted to angiotensin 2 by another enzyme known as ACE, which is secreted by the lung. That is angiotensin converting enzyme. Ultimately, angiotensin 2 will go to the adrenal cortex and causes release of the aldosterone. And aldosterone causes sodium water retention. Now, if hypovolemia is there, renal ischemia is there, GFR also decreases, that again causes sodium water retention. And if hypovolemia is there, in the posterior pituitary in the brain, it causes increased ADH release from the posterior pituitary, so patient feel more thirsty. So increased water intake. All ultimately lead to increased blood pressure and edema. So this is the compensatory mechanism you can see. That is the first stage. That is compensated stage. We have seen the various mechanism of the compensation. Renal ischemia and posterior pituitary ADH release. These are the two main mechanisms which are causing compensation in the compensated shock, compensated stage of the shock. Coming on the second stage of the shock, that is decompensated reversible stage. Still it is reversible. It is decompensated, but still it is reversible. So cardiac output here is decreased with tissue hypoperfusion. Tissue ischemia is there, leading to lactic acidosis. Pulmonary hypoperfusion is there, leading to ARDS. But all of them are reversible if you remove the cause of the shock. So if you rectify, it is reversible. The last stage is decompensated and it is irreversible. So when the shock is so severe that in spite of compensation and therapy and control of etiological stage, still no recovery take place, it is decompensated reversible stage. Here multiple organ failure ultimately take place. So that is the third stage of the shock. So we can appreciate the three stages here. The first stage is compensated stage, in which tachycardia and cool extremities are there. The second is progressive decompensated shock, in which decreased cardiac output, mental confusion, decreased urinary output, tachypnea, that is multiple tissue dysfunction take place. And third is irreversible decompensated stage, in which all the organs have hypoxia and it is irreversible in spite of therapy, in spite of correction, in spite of removing the etiological cause causing the shock. It is irreversible. So the various organs are involved, they are in front of you. So in brain, it is ischemic encephalopathy which take place. Inside the heart, it is coagulative necrosis which take place. Inside the liver, it is fatty change with hemorrhagic central necrosis or shock liver take place. Inside the kidney, it is extensive tubular ischemic injury take place. In the adrenal, it is cortical cell lipid depletion take place. In GIT, it can be hemorrhagic enteropathy. Lungs are uncommonly affected but may show the features of diffuse alveolar damage or shock lung. So these are the various organs which are affected in irreversible stage. So we are done with the three type of shock. So first shock we have studied is hypovolemic shock. The cause is inadequate blood or inadequate plasma volume. It is less than 5 liters in human body. It can be due to trauma, it can be fluid loss, hemorrhage, vomiting, diarrhea, burns, trauma, anything. So that is hypovolemic. The second type of shock we have learned is cardiogenic shock, in which there is failure of pumping, either systolic dysfunction or diastolic dysfunction. That can be result of MI, ventricular rupture, arrhythmia, cardiac tamponade or pulmonary embolism. That is cardiogenic shock. And the third type of shock is septic shock, in which either gram-positive or gram-negative bacteria. So microbial infections are there, usually gram-positive or gram-negative, that can lead to various cytokine release that can causes peripheral vasodilatation, pulling of the blood, endothelial activation and disseminated intravascular coagulation. That is the three type of shocks we have learned. So what is the summary of this session? What we have learned in this session? In this session, we have learned what is shock. What is the definition of shock? Shock is not a disease of one particular organ in human body. Shock is a disease in which multiple organ failure take place. So basically in the shock, it is a clinical syndrome in which there is poor tissue perfusion to multiple organs in the body. Now imagine all the organs of the human body, they are receiving less blood. So less blood means less oxygen. Less oxygen will lead to cell death. Cell death of that organ lead to organ failure, and multiple organ failure leads to whole body failure. Whole body failure leads to death. So it is a clinical syndrome in which it takes place step by step, and multiple organ failure and death is the end result of shock. After that, we have seen the classification of the shock. In the classification of shock, there are three important types of shock: hypovolemic shock, cardiogenic shock, and septic shock. In others, we have seen neurogenic shock, anaphylactic shock, adrenergic shock, but only pathogenesis is important, but in others, the details are not important. So we must study the three types of the shock. So we have seen the pathogenesis of all three types of shocks in this diagram. The first shock is hypovolemic shock, in which less plasma volume is there. Less venous return, less cardiac output, less blood flow to all organs, less oxygen supply, all organs undergo anoxia and having shock. That is hypovolemic shock. The second type of shock is cardiogenic shock. That is either inadequate systole or inadequate diastole. Here also cardiac output is less, which leads to less blood, less oxygen and anoxia of multiple organs. The third shock is septic shock. It is due to infection, gram-positive or gram-negative bacteria that is causing activation of macrophage by stimulating CD14 receptors on macrophage. And that is causing the release of certain cytokines. You can see certain cytokines are released due to the macrophage activation, either gram-positive bacteria or gram-negative bacteria. If it is gram-positive bacteria, it is lipoteichoic acid released in the blood. If it is gram-negative bacteria, it is lipopolysaccharide released in the blood. Both of them, gram-positive, gram-negative, lipopolysaccharide, lipoteichoic acid, they will cause macrophage activation through CD14 receptors on the macrophage. Macrophage secretes certain mediators, certain cytokines, chemicals, that is TNF-alpha and IL-1. That is causing release of secondary mediators and leads to vasodilation, capillary leak, and that is leading to septic shock, the second type of shock. Lastly, we have seen the stages of the shock. Shock is having three stages: compensated shock, progressive decompensated shock. In the compensated shock, tachycardia and cool extremities are there. In progressive decompensated shock, multiple organ dysfunction is there. So decreased cardiac output, mental confusion, decreased urinary output, tachypnea can be there. And lastly, irreversible shock. In irreversible shock, all the organs of the human body undergo hypoxia. So in the brain, hypoxic encephalopathy, in the heart, myocardial necrosis, in the lungs, ARDS, in the kidney, acute tubular necrosis, in the adrenal necrosis, in the GIT, gastroenteropathy, in the liver necrosis, in the blood, there is DIC. So that's all about shock.